Good afternoon, friends. Today, our most popular English daily, Hindu, it carries an article about Monty Lucas. They kind of describe it as dangerous and overused. And it causes a kind of a panic reaction among lots of patients, hundreds of patients, thousands of patients who are on Monty Lucas for a very long term. In this context, I felt I have to kind of demystify some of the thoughts that are being shown in today's Hindu. Well, it says very clearly that it's a personal opinion of the doctor and personal opinion of the postgraduate student who are shown in the cover page. Well, having said that, we should never really take personal opinions very seriously. Each person may have an opinion about a drug based on his limited experience. We don't know how many years these doctors have been in practice and what kind of a practice they were doing. They were strictly doing like a pulmonary medicine, or were they doing asthma allergy medicine? There is a difference between the two. Also, we need to look at big studies. Thousands of patients should be studied who are on Monty Lucas over a long period of time, and medically, technically, we call meta-analysis. That means, it's not individual study, but it's group of studies, a collection of many large trials, studies that are conducted in different parts of the country, sometimes even different parts of the world, and then they go into the statistics very critically and come with the findings whether there are really the kind of a side effects that are attributable to Monty Lucas. Is it true? How many of them had it? After how long they had it? And were there any other risk factors that were associated to make them get that kind of a side effect? So all these things have to be looked into. Let me just go over very briefly my personal opinion on that, based on my experience with this medicine for nearly 25 years. I think from 1998 I have been using this medicine. To make it very crisp, I want to tell that Monty Lucas is an extremely safe medicine. It's a very effective medicine, and the only problem with Monty Lucas, I feel, is it's overused. Everybody is using Monty Lucas. It is not being prescribed by doctors who are qualified to prescribe Monty Lucas. All the GPs are writing it, and doctors who got very little experience with this drug, they are just writing left and right. They are using this Monty Lucas. That is something that needs to be curbed, that needs to be stopped, and I think that needs to be checked, because once you start abusing a medicine, the possibility of entertaining side effects also increase. That could be one of the reasons that many feel that this may be a dangerous drug. Any drug that is abused, overused, and used inappropriately for the wrong indications and the wrong combinations, I will come to that soon, they can be potentially dangerous. Monty Lucas, being a very popular molecule, is being manufactured by lots of companies. We use standard brands, like 4 or 5 brands only we use, but I come to know that pharmacies, they just dispense Monty Lucas molecules made by different people. I don't want to sound sarcastic. The truth is, it is being manufactured in a substandard condition with very poor quality control by many pharma whose name doesn't even sound familiar. It's like somebody making a drug in their backyard, or in a shop, or in some kind of a less scientific setup, not a real pharma company with strict, stringent quality control and things like that. This has to be discouraged. Also, Montelukast is available in many combinations. Combination of Montelukast with antihistamine, which is the most popular combination. Sometimes we can use it for like 3 months or 6 months, and then we can switch over to plain Montelukast, because combining with an antihistamine for very, very long term, unless there is severe allergy, it is not scientific. I understand that. Also, the fact is Montelukast is sometimes combined with bronchodilators, which does not make any sense. It should not be that way. Montelukast combined with mucolytic like acibrophylline or N-acetylcysteine or something like that, that is also available. Again, it is a very, very unscientific combination. These things have to be curbed. The most important aspect why we need to look at this issue very critically is a lot of doctors, they feel very uncomfortable prescribing an inhaled steroids or the proper asthma preventive inhalers. For some reason best known to themselves, maybe a mental block, or they have lack of knowledge about inhaled steroids and its long term safety and things like that. So, they kind of initially start everybody on Montelukast. But Montelukast is a poor substitute for asthma prevention compared to ICS or inhaled corticosteroids. We never use Montelukast as a single drug for asthma prevention. We always use the inhalers. And most doctors who are trained in asthma and allergy would do the same thing too. But we use Montelukast and antihistamine combination because we have allergic rhinitis, allergic rhinosinusitis as a main trigger for asthma, especially in uncontrolled asthma. So, there is a very essential pivotal place that Montelukast plays in our practice. So, we use a lot of that. We have several thousand patients on that. About some studies saying that Montelukast could induce depression or psychotic tendencies or maybe suicidal behavior or something like that. These are mostly in Western literature, USA or UK or something like that. We all have to understand every person reacts differently to every medicine, and some of these medicines have got a lot more side effects in the Western population and Caucasian population compared to Indian population. Even some of the vaccines also, they have much worse side effects compared to the Indian population. So, what is good there may not be good here. So, what is described as bad in USA may not be bad here in our Indian setup. So, I have to tell you, at least for 20-25 years I am prescribing this. I have lots of patients from all age groups, small children and very old people. I am yet to see serious side effect with this use. I have few patients who are not able to tolerate it because they developed skin blisters or something like that, and some of them are just like allergic reaction to like rashes and things like that. Some of them complain about gastric upset. There are very, very few. If I am talking about giving this medicine for thousands of patients, maybe I had 10 or 20 patients in whom I have to discontinue this medicine and go with alternate medicine. So, Montelukast is essentially a very, very safe medicine, extremely efficacious, very, very effective for allergies, long term allergy, because it blocks the release of chemicals that are commonly seen in allergic reaction. We call them leukotrienes. It blocks the release and the effect of leukotrienes, basically leukotriene receptor inhibitors. That is how Montelukast is acting. In this context, I want to tell you that even allergy like allergy to peanuts, we see a lot of allergy to peanuts in USA. There is even deaths reported, like 8 people who died after eating a peanut, or another 8 guys who went to ICU, near death situation. I am yet to see single case of peanut anaphylaxis here in India, even though I am in practice for more than 25 years and we do skin testing, and I am yet to see a serious peanut allergy here. Whereas it is widely popularized in USA to the point that the airlines stopped supplying peanuts. They all went to other nuts or some other snacks, not peanuts. So, basically I think pretzels, that is the name I want to tell. Instead of peanuts, they are giving pretzels. So, I do not think you need to get very excited. I want this message to reach all my patients and everybody who reads the Hindu article and get excited about Montelukast and it is not being safe and things like that. Just realize that this drug is safe, but it should not be abused. I'm not for that. You know, if it's given for the right indication, for the right duration, it is quite a safe medicine. The fact is, it is overused and that needs to be stopped. And it's being manufactured by thousands of companies without any quality control. That needs to be stopped. The other day, somebody came. I wrote a prescription for a branded Montelukast, and then he came with a brand that I was not familiar with. Then he told me, when he went to the pharmacy, apparently the pharmacist told that if you take this medicine, he will give a discount. But the fact is, this pharmacist, I am not telling all pharmacists, there are pharmacists who just get 1 or 2 strips of Montelukast free when they buy 1 strip of Montelukast or Montelukast combination with an antihistamine. That means it's unethically promoted. Pharmacies are kind of induced to sell Montelukast combinations because they make a huge profit out of that. That needs to be stopped. These are practical problems, but to blame a drug without really rhyme or reason that it is unsafe, it's overused, that's not a right thing to do, especially when it comes in a very, very reputed daily like Hindu. People definitely take it very seriously. I already have received so many messages from my patients about the safety, but you just have to believe the doctor who is prescribing this to you. If he is experienced and he is knowledgeable and he knows what he is doing, then don't worry about that. You never learn pharmacology from Hindu or Indian Express or Dinamalar or Dinamari. You learn your pharmacology from pharmacology professors. That's what we all did. I hope I made things clear. I kind of put all your exciting anxiety and other things to rest, and you have a free, clear mind that Montelukast is safe. You can continue to use it until we stop that medicine. Okay? Thank you. If you have any questions, feel free to contact us through messages, not phone calls. Okay? Thank you.